This topic is for people with overweight, obesity, insulin resistance, but above all, high blood pressure. Many colleagues say hypertension is about genetics, about predisposition. It's true that predisposition exists, but that's like having a loaded gun. If it isn't fired by bad habits, the disease doesn't develop. And if there's no predisposition, even better. But whether or not it's there, what actually triggers high blood pressure is habits, especially diet, without underestimating exercise, sleep, and muscle mass. Today we have a special case for our entire lifestyle medicine team and for the more than 3,000 patients we've treated. God gave us the wisdom to guide her, a 16-year-old girl who came to us with high blood pressure. You're going to hear from her and her mom. This is the motivating part of it. Nutrition really can lower blood pressure, so much so that many patients end up controlled with food alone, the same way others get controlled with pills alone. Lifestyle is just as important as medication, sometimes more. We've talked here before about this root vegetable, beetroot, and how it lowers blood pressure, but today comes part 2, which foods, combined with beetroot, amplify its blood pressure lowering effect. This is the first thing a doctor should say before prescribing medication, and if they're already prescribing it, they should use the lowest possible dose to avoid the well-known side effects. Let's look at what evidence-based medicine says, and then I'll tell you about this beautiful case. Look at this study published in the Journal of Applied Physiology. It's titled A Toast to Health and Performance, and it says, colleagues, beetroot juice reduces blood pressure and the oxygen cost of exercise and improves physical performance. The more the vessels dilate, the more blood reaches the tissues, the lower the pressure, and the more physical endurance we have. What blood pressure medication does both of those things at once? The authors conclude that a dietary therapy that reduces blood pressure and increases exercise tolerance could help avoid the use of costly medications with potentially harmful side effects. Why does it work? Beetroot contains dietary nitrate that gets bioconverted into nitrite and nitric oxide, producing a vasodilatory, antiplatelet, and vessel protective effect. A study published in a cardiology journal showed systolic blood pressure dropping progressively, hour after beetroot consumption. The only side effect is that urine may turn a reddish color, nothing more. And before you ask, yes, many hypertensive patients are also diabetic. Beetroot has sugar, but it also has nutrients that keep that sugar from spiking glucose. If an unprocessed, super healthy food like beetroot raises your blood sugar, it's time to check just how metabolically unwell you really are. The American Heart Journal concluded that these findings suggest dietary nitrate from beetroot underlies the benefits of a vegetable-rich diet and highlights a natural, low-cost approach for treating cardiovascular disease. This should be posted at the front door of every cardiology office. Before I give you the 3 combinations that amplify beetroot's effect, I want to introduce our dear friends Nicole and her mom, Kathy. Nicole came to us as the youngest patient we've ever had in the program. 16 years old with sky-high blood pressure, Kathy explains that Nicole came in with readings of 160 over 110, which was deeply worrying for any parent. Her cardiologist prescribed strong doses of medication, 20 milligrams, which caused headaches so intense that Nicole couldn't live a normal life or focus on her studies. Afraid of the side effects, she stopped taking them. Later, tests revealed proteinuria, protein in the urine, and a nephrologist diagnosed her with stage 2 kidney disease. Again, more pills, and again, no results. While searching social media, Kathy found the lifestyle medicine program and decided to give it a try. The changes came fast. Within a week and a half, her blood pressure started dropping. Today, Nicole holds steady at 116 over 79, readings that never used to happen. No one had ever recommended changing her diet before. Doctors only prescribed pills, which was a constant fear for them as parents, given that this was happening to a teenager. Nicole confirms the headaches were so intense they kept her from studying or resting, and that she sometimes felt dizzy but had no other symptoms despite her blood pressure being so high. As for her kidneys, 1 month into the program, her nephrologist reran the tests, and Nicole had moved from stage 2 to stage 1 kidney disease. Her doctor was stunned. He found it hard to believe it was diet alone. He also personally reduced her medication from 20 milligrams down to just 5. On the diet itself, Nicole admits it was hard at first to give up burgers, pizza, fried chicken, and fries. Pretty typical at 17. but she adapted better than she expected. Today, even while traveling, she looks for options that fit her new way of eating because her body asks for it now. Kathy recommends the program 100% to anyone dealing with hypertension or diabetes and is grateful for a team that walked with them through every step. Nicole closes by saying that at first it was hard to believe food alone could heal so much, but the team's support made her feel at home, and that this is a commitment for life. See what happened there? Now, what do I mix with beetroot to lower blood pressure? And keep in mind, this doesn't mean stopping medication on your own. Nicole came off hers under medical supervision, just like most of our patients. First, lemon. Studies show beetroot's effect is amplified by vitamin C. It speeds up the conversion of nitrite into nitric oxide, the molecule responsible for vasodilation, protects against insulin resistance, and lowers blood pressure. Second, ginger. Once a week. It improves blood viscosity, making it flow more easily so it reaches the vessels better, dilating them and producing an anti-inflammatory effect. Yes, you can combine lemon and ginger together. No problem there. Third, dark chocolate. No milk and no sugar, because with milk and sugar, you lose chocolate's benefits. Chocolate contains epicatechin, which sustains elevated cyclic GMP levels and signals blood vessels to dilate. It also stimulates a second pathway of nitric oxide production at the level of the endothelium, the inner lining of the arteries. It sounds strange mixed with beetroot juice, but it works. What more do you need to give yourself this chance, the way this young girl and so many other patients have, to be one less statistic among hypertensive and diabetic patients, to avoid medication side effects, and above all, to avoid serious complications, kidney damage, dialysis, blindness, amputation. Keep in mind, we are not against medication. We are against the excessive overuse of medication. Today you saw a special complex case. Through nutrition, in less than 2 weeks, a 16-year-old girl went from 160/110ths to normal blood pressure, using only a fraction of the medication she was on before. If a teenager could change her habits, what are you waiting for? I invite you to join the Lifestyle Medicine program. Message us. Come to the masterclass. Remember, lifestyle medicine is an evidence-based medical specialty that uses nutrition, exercise, sleep, hydration, and the right habits to reverse chronic disease. Want to reverse your hypertension, reverse your diabetes, lose weight, and take less medication? We give you your health back. I take care of you.